Did you hear anything in this speech that you think could help the overburdened system?
Nothing.
And Dr. Warner,
there was no plan. I mean, and in listening to Sylvia Jones yesterday, it doesn't seem like she believes there's any type of crisis. So that disconnect between the front line and then the politicians who we put in place to make decisions to help maintain the healthcare system is highly concerning.
I was going to say, what do you think about the fact that she doesn't even think there is a crisis?
You know, I'm not an emergency physician, I'm an ICU physician, but I respect my nursing and physician colleagues who have worked in the emergency departments for years and years, who tell me that this is an unprecedented situation. You know, Dr. Christopher Simpson, Matt Anderson from Ontario Health both feel that this is a crisis, or that would be an appropriate word to use. So there seems to be a disconnect within the government bureaucracy. But at the end of the day, when you tell people who are working in the front lines that what they're experiencing isn't happening, that's gaslighting. And that really adds to the moral distress and burnout of the people who are working day in and day out to try and keep people healthy, keep people safe. And to normalize the fact that a hospital like Montfort in Ottawa, which has 269 beds, can have its emergency department closed for 12 hours on Saturday and 12 hours on Sunday night, I think that's irresponsible. That should not be something that we accept. It should be a never event. And the government, they can't be blamed for all of this, but it is their job to get us through this.
What concrete action are you and your colleagues calling for?
Well, I don't speak for anyone other than myself, and I think the most important thing is to hear from frontline nurses as opposed to physicians. But I think at the very least, you need to acknowledge the situation that we're in, like Premier Ford did with COVID, and throw all the resources necessary right now to make sure that emergency departments never close. That can't be acceptable. Bill 124, which subjects public sector workers to 1% pay freeze, simply needs to be removed because that is just crushing the nurses' morale. I mean, they're working so hard, and to get a sub-inflationary pay increase when they've been working for 2.5 years is just not fair, and it's a real sticking point for people on the front lines, not just nurses, but other public sector workers. If we're going to have internationally trained and credentialed nurses come into the system, which I think makes sense, we have to make sure that the nurses who are currently working in the system and overburdened aren't saddled with training orienting them, because it takes a while to bring people up to speed. So nurse educators, whether they be retired nurses or more senior nurses who are working part-time, need to be paid appropriately to train these new nurses so they can work effectively. And then finally, we have a huge issue in this province whereby private agencies are paid public money to staff hospitals with nurses. They're called agency nurses. These nurses are skilled, they're trained, they are appropriate clinicians, they work in my ICU every day, and they're fantastic. They're paid more than unionized nurses in lieu of benefits and pension. But even with that, missing the benefits and pension, they're still paid more than their colleagues that they're working side by side with. Full-time nursing is not an appealing career. Is it just about the money, or is it career flexibility, work-life balance, lack of childcare in hospitals, all these things the union needs to work with the government on to make sure that nursing is a sustainable place of employment into the future as demographics change.
Let me ask you what the situation like is now compared to at the height of some of the COVID waves.
Well, this is what I find really concerning. So the truth is there's very little COVID activity in hospitals right now. But the system is under way more stress than it ever has been in the summer. Like, summer is usually a slower period of time. If we have any type of COVID bump in the fall, I think the system will be brought to its knees. And that's what's very concerning to me, because the same people who have been grinding for 2.5 years and some are leaving the profession are going to be asked to step up yet again with really no support and no recognition by the government that the situation they're feeling is actually what's happening.
Dr. Warner, I've got to leave the conversation there. Appreciate you stopping in today. Thanks for that.
Take care.